Good morning. Thank you, Chairman Frank, Vice Chair Rose, and esteemed members of the committee for the opportunity to lay out House Bill 465 for you today. As many of you are aware, during the 85th, 86th, and 87th legislative sessions, we greatly recognize the need to reduce the maternal mortality and morbidity rate in our state. I am very proud of the bipartisan efforts the House and ultimately the Senate used to pass legislation extending the Texas Maternal Mortality and Morbidity Review Committee and the potential for expanding postpartum Medicaid coverage to 1 year this session. We look forward to passing that bill with Vice Chair Rose. While excellent progress is being made, our work is not done. The American College of Obstetricians and Gynecologists, commonly known as ACOG, has addressed the best ways to improve maternal health outcomes, and one of their top recommendations is to increase access to doula care throughout a woman's pregnancy. However, for Texas mothers who give birth on Medicaid, doula support is financially out of reach. HB465 solves this issue by including the scope of doula services to cover pregnant women currently enrolled in Medicaid. HB 465, also known as the We Love Doulas bill, establishes a pilot program to provide Medicaid reimbursement for doula services in the most populous county in Texas with the greatest maternal health support needs. Last session, this bill passed in a bipartisan manner through this committee. I want to thank Representative Hall and Vice Chair Rose for being joint authors and other members of this committee for voting on the bill. It also passed on the House floor, but it was unable to move in time through the Senate. This session, we have an early opportunity to improve health outcomes for Texas moms and babies through providing doula support. For those who may be new to the term doula, doulas are trained professionals who provide non-medical, physical, emotional, and informational support for mothers throughout the childbearing process so that moms and babies can achieve the safest and healthiest outcomes. I'm going to now give you some fast facts. Number one, currently about 35% of mothers in Texas have a C-section, and the risk of severe maternal complications with a C-section is 3 times greater than those moms who have vaginal births. These complications may include cardiac arrest, hysterectomies, blood clots, hemorrhage, HELLP syndrome, and infection. However, doula-assisted moms experience shorter labor, 25% shorter labor, and a 28% reduction in cesarean sections. Doula services also generate savings over time to our state Medicaid program due to the reduction in cost associated with C-sections. For example, the average C-section costs approximately 50% more than a vaginal birth. In terms of Medicaid, a C-section can be billed to the state Medicaid system in the amount of up to $19,000. Statistics show that almost half of C-sections are preventable with doula care. Studies also indicate that doula-assisted mothers are 4 times less likely to have a low birth weight baby and less likely to experience other birth complications. 16 states, another fast fact, have already passed legislation that covers doula services under Medicaid. I aim to say, Texas, we got next. Those states are D.C., California, Florida, Maryland, Michigan, Ohio, Minnesota, New Jersey, Nevada, Oregon, Rhode Island, Virginia, Massachusetts, Connecticut, Illinois, and Pennsylvania. Also, many private insurance companies already acknowledge the efficacy of covering doula services by including them in their health plans. However, as stated, there remains a stark disparity in doula access for Texas women giving birth on Medicaid due to a complete lack of coverage. The current state for maternal health care indicates that more work, as I said, needs to be done. Many of you members remember calls to release the 2022 report from the Maternal Mortality and Morbidity Review Committee and through DSHS. This joint biennial report revealed that we still have work to do, and almost 90% of pregnancy-related deaths were preventable. There was a very unfortunate fact that was revealed in the report, which showed that the rates of hemorrhaging for Black mothers persisted while the rate of hemorrhaging went down in every other group. So this bill will fill a gap in maternal health care, making Texas a safer place for women to give birth. HB465 aims to improve those health outcomes while simultaneously reducing costs. Keep in mind, members, the pregnant mothers impacted by this bill are already covered under Medicaid. So we would not have to, quote unquote, expand Medicaid. They're already enrolled in the system. So this bill, I believe, will go hand in hand with the priority of the House to expand Medicaid to 1 year to mothers from postpartum to 6 months to 1 year. Healthier mothers means healthier babies. The loss of even one mother or baby is way too many. So we must remain deeply committed to improving maternal health care for women. Members, I urge you to consider the life-saving benefits and as well as the cost savings of doula services by putting Texas moms and babies first. I believe we have some witnesses who will share some of the amazing work that doulas are doing across our state and to improve maternal health outcomes. And with that, I respectfully reserve the right to close and answer questions.
Thank you. Just one quick question. Then, that data that you show with lower C-sections, could you provide that to just afterwards? Because the fiscal note, which obviously fiscal notes make it difficult, but if there's a reduction in C-sections, there's a chance if we work on the fiscal note, we might be able to get this done.
Absolutely, Mr. Chairman. And also, this fiscal note from last year made this comment, and I noticed it just came out at 8 this morning, also acknowledged that the cost, any cost to implement the pilot program would be offset by the potential savings for the additional hospital stays and costs. So I was pleased to read, even within the fiscal note, that it says it is assumed that the cost of providing doula services can be accomplished by utilizing existing agency resources and may be offset by decreased costs primarily related to reduced needs for clinical procedures.
Because I think that's really important, particularly, and one of the most disturbing things I've ever seen is the increase in C-sections on Fridays. And it really, when you think about doing a procedure on Friday to make sure your weekend's clear, whether that's intended or unintended or just coincidence, but it's probably not. But I think having a navigator probably prevents some of that stuff.
Thank you, Mr. Chairman, for making that comment. That's very well documented, that more moms are, when doctors are kind of ready to get out of there sometimes, or hospitals. I can honestly say, you guys have heard me talk about my experience, but as a first-time mom, I was told to get a C-section, and I found out later I really didn't need one. And because I was afraid, I didn't know to challenge it, and I ended up having that near-death experience. And I just kind of wish looking back, had maybe a little more information or someone there with me to say, well, Shawn, maybe you can wait a few more hours. You don't have to do this, because I was perfectly healthy, and so was Claire at the time. Okay. So I reserve the right to close.
Yep, you will certainly have it.